So when I see patients with, let's say, plantar fasciitis, most of them have had pretty significant or severe pain in their heel, at the bottom of their foot for weeks and sometimes months. And they've tried all kinds of things. But what's important is that they've done stretching for the bottom of their foot and their heel cords. They've been using ice, maybe anti-inflammatories, doing therapy, because that in mild cases may be enough. But when it isn't, and you still have that point tenderness that in the morning when you try to get out of bed and that first step is excruciating, that's just no fun. And if you've ever had it, you understand that it's terrible. It's very unpleasant. And so I treat plantar fasciitis with platelet-rich plasma injections. I've done many cortisone shots in the past, and cortisone can be a good treatment option, but I really like using your own cells first, platelet-rich plasma, with a double spin method. We are able to obtain very high concentrations of all the growth factors in your blood. Something else I use that I like even more is a product called Vitti-Pure, and it's a PRP substitute obtained at the time of birth from pre-screened donors from Vitti Labs, and it is an umbilical cord product. And so it is not umbilical cord stem cell, but it's really all the growth factors, more growth factors than we have, and actually some exosomes in with it. And it's very cost effective. I charge the same as we do for a PRP injection, which is thousands less than an exosome or stem cell injection, which for very difficult and stubborn cases, would be the way to go as well. And so using your PRP, Vitti-Pure, those things work extremely well and are highly effective. And it's usually one and done. We may do ice and stretching and some modalities and things, including shockwave therapy. We do StemWave shockwave therapy, which is state-of-the-art focused shockwave, which triggers healing at the cellular level. So combining some of those things, even red light therapy. So there's a number of things we can do for very stubborn conditions like plantar fasciitis that are effective and easily taken care of. Well, everyone is different when it comes to how fast does this work. Generally, and certainly when we're talking about lateral epicondylitis, tennis elbow, other conditions, very rapid, within hours to days or weeks. I recently did a big toe, a very arthritic big toe that you may see a video of. And she walked out with no pain and has had no pain ever since. And that's after seeing her orthopedic surgeon who operated on the other foot, did things that he said, you just have arthritis. There's not much I can do other than maybe some cortisone. And so it's very curative in general with plantar fasciitis. It can be sore just from the injection for a few days. So that it's not always instantaneous. I wouldn't want to promise that to anyone. But within days to a week, it is dramatically improved because it's very anti-inflammatory and it triggers healing at the cellular level. It's usually just one injection. In maybe stubborn cases, we might have to do it again in a month or 6 weeks, but not too often. It's usually one injection. Well, I'd like to think I'm pretty good with doing these injections and that patients do have minimal pain. Obviously, we use a liquid nitrogen product to make the skin cold so you don't feel the needle. And then we put, the numbing solution in. Once that's there and injected into the same area, it's tolerable. Yes, it can be uncomfortable. I can't say it's pain-free, but it's very tolerable. I do a lot of injections, knees, number one, shoulders two, hips third, probably ankles, sometimes the base of the thumb. I mean, there's almost nothing that we can't find a way to get a needle in. And so, if you're suffering from a chronic degenerative knee, I did today a meniscal tear on a woman who's had pain for a number of years. tried PRP before, helped a little for a while. And so today we did 100 billion nanoparticles of exosomes. And I expect her to see tremendous relief. I did a hip yesterday. Again, same kind of thing. Actually, that hip, 6 weeks after using exosomes, she had no pain, a little soreness with movement, but I do what I call the fertilizer shot. So at 6 weeks later, I use the Vitti-Pure product to help maintain a healthy environment for those cells and for that cartilage to grow and heal to further reduce inflammation. So most of the time in major joints, we use exosomes or stem cells initially, and then what I call the fertilizer shot around 4 to 6 weeks, which is just another growth factor injection of either your own platelet-rich plasma or umbilical cord-derived PRP substitute. Well, it's pretty easy to find us by just going on our website, aspen-regenerativemedicine.com, that you may see at the bottom of the screen here. You can find my podcast, Beyond the Fountain of Youth podcast on YouTube, and there's almost always a tag there or a link to reach us and schedule a consultation. If I see a lot of patients, I see patients from all over the world. So if you're out of state or elsewhere, then we do a telemedicine exam to talk and discuss things. I might want to order a routine x-ray, maybe an MRI is in order. And so if those have already been done, then we request that those are emailed to us, and so that we can either see the images or see the MRI reports, and then a physical exam, seeing someone, when someone comes in and wants, because not everyone knows, okay, am I a candidate for this? I'll tell you, if you want to avoid major surgery, you're a candidate. And the question then of how effective depends on the physical examination. How much pain is there with motion? What do I feel when I do the exam? And based on 45 years of experience, I would like to think I'm pretty good at being able to predict who is probably going to do very well with it. There are limited occasions when I say, you know what, it's just too late, and you probably need to go ahead and do the joint replacement. So that happens sometimes, but 90% of the people that I see with hips and knees have been told, hey, you're bone on bone, you need a joint replacement. The vast majority have gone many years, 5 to 7 years, and they're still doing fine. I have some that are 10 years out that I've done a second injection because they said, you know what, I've been great for 7 years, but it's maybe a 1 or 2. It's kind of bugging me again. Can we do some more? I'm like, of course, let's fix it. And so it's really very rewarding from my standpoint after 45 years of a sports medicine career and referring many patients out. I have a lot of friends that are surgeons, and so I'm not saying that there's not a time and place for surgery, but when we can really help someone relieve their pain, improve their quality of life, let them back to all their activities in a short period of time without the downtime of major surgery, then that's a plus. That's what people are really looking for, and that's something that we can offer.